Welcome to a deep dive, into SLE. It's a chronic autoimmune disease. Basically, your immune system decides to attack your own body. And as you can imagine, that has some pretty widespread consequences. So we're going to unpack how SLE impacts different organs and systems and try to answer the big question of, what does it really mean to live with this unpredictable condition?
It's a bit of a biological mystery wrapped in a medical enigma. SLE can manifest in so many ways, with symptoms that range from mild to severe. And they often come and go in these unpredictable cycles, right? These are called flares and remissions, and this makes diagnosis and management particularly challenging.
Yeah, it sounds like a real roller coaster ride for those who are dealing with it. So let's start with one of the most common and serious concerns, kidney complications. What's a leading issue we see in SLE patients when it comes to the kidneys?
Well, the biggest worry is lupus nephritis. It's when these antibody clumps, you can think of them as little immune system soldiers. And they've kind of gone rogue, right? They get stuck in the kidneys and they start causing inflammation and damage. And here's a startling fact. About 25 to 50% of people with SLE develop some sort of kidney problem, and often within the first 3 years of being diagnosed.
Wow, those numbers are definitely eye-opening. So if someone's diagnosed with SLE, are there any early warning signs of kidney issues they should be aware of?
Absolutely. Things like changes in urination, swelling in the legs or ankles, and high blood pressure can be red flags. The key takeaway here is early detection. The sooner lupus nephritis is caught, the better the chances of preventing irreversible damage.
That makes perfect sense. Early intervention is key. But what happens if lupus nephritis is left untreated? What's the worst-case scenario?
Well, unfortunately, in about 10 to 15% of cases, it can progress to end-stage renal failure. Essentially, the kidneys shut down. At that point, dialysis or a kidney transplant becomes necessary. It's a sobering thought, but it really emphasizes just how crucial it is to manage SLE proactively.
Okay, let's shift gears a bit and talk about another organ that's often affected by SLE, the heart. How does SLE impact the cardiovascular system?
So SLE can cause inflammation of the heart itself, either the sac surrounding it, which is called pericarditis, or the heart muscle, known as myocarditis. Both conditions can cause chest pain, shortness of breath, and even rhythm abnormalities.
So it's not just about joint pain and fatigue. SLE can actually attack the very organ that keeps us going. What should someone with SLE be looking out for in terms of heart-related symptoms?
Keep an ear out for any unusual chest pain, especially if it worsens when lying down or taking a deep breath. Unexplained shortness of breath or a rapid or irregular heartbeat should also be reported to a doctor right away.
Now, I know from the research that SLE is associated with an increased risk of atherosclerosis or the buildup of plaque in the arteries. Is that because the inflammation caused by SLE speeds up that process?
That's a big part of it, yeah. SLE can accelerate atherosclerosis, increasing the risk of heart attacks and strokes later in life. It's like adding fuel to a fire that's already smoldering.
So managing cardiovascular health is paramount for anyone living with SLE. What about the brain? Can SLE affect the nervous system?
Absolutely. SLE can impact both the central and peripheral nervous systems, leading to a wide range of neurological and psychiatric issues. We see everything from headaches and seizures to anxiety, depression, and even psychosis in some cases.
That's quite a spectrum. What's going on at a cellular level that causes such diverse neurological effects?
It's a combination of factors. Autoantibodies can directly attack brain cells, causing inflammation and damage. There can also be issues with blood flow to the brain, which can lead to cognitive impairment, stroke-like symptoms, or even seizures.
It's amazing how one disease can have such far-reaching effects on the body. Are there any specific warning signs of neurological involvement in SLE that people should be aware of?
Definitely. Pay attention to any new or worsening headaches, especially if they're severe or accompanied by other neurological symptoms, like vision changes, numbness, or weakness. Cognitive changes, such as difficulty concentrating or memory problems, are also concerning.
Okay, so we've covered the kidneys, the heart, and the brain, all pretty vital organs. What about the lungs? Does SLE impact the respiratory system as well?
Yes, unfortunately, the lungs are also vulnerable. The most frequent lung issue we see is pleural effusion, which is a buildup of fluid around the lungs. This can cause shortness of breath and chest pain.
I can imagine that would be quite uncomfortable. What are some other lung complications that can arise from SLE?
Well, there's lupus pneumonitis, which is inflammation of the lung tissue itself. This can lead to coughing, shortness of breath, and even difficulty breathing in severe cases. Another serious complication is pulmonary hypertension, which is high blood pressure in the arteries of the lungs. This can put a strain on the heart and make it harder to breathe.
It sounds like SLE can really impact your ability to breathe freely. What signs or symptoms should someone with SLE be on the lookout for in terms of lung involvement?
Any unexplained shortness of breath, especially if it worsens with activity or when lying down, should be checked out. A persistent cough, chest pain, or wheezing could also signal a problem.
All right, let's move on to another area that's often affected by SLE, the joints and bones. I understand that joint pain is a very common symptom.
You're absolutely right. The majority of people with SLE experience some form of arthritis. Typically, it presents as pain, stiffness, and swelling in the joints.
Is the arthritis associated with SLE similar to rheumatoid arthritis, or are there key differences?
Well, while the symptoms can be similar, there are important distinctions. SLE arthritis is generally non-erosive, meaning it doesn't cause the same kind of joint damage and deformities that we see in rheumatoid arthritis. However, it can still be quite painful and debilitating.
So it's like a different type of wear and tear on the joints. Is there any specific type of arthritis that's unique to SLE patients?
There is. It's called Jacquard's arthropathy. It's a rare but distinctive complication that can cause deformities in the hands, particularly the fingers. Imagine swan neck fingers, where the joints are bent in an unusual way. It's a bit like a sculptor's clay that's been molded into an odd shape.
Wow, that sounds pretty striking. Now, I've also read that osteoporosis or weakening of the bones is a concern for people with SLE. Is that directly caused by the disease itself, or is there another explanation?
Well, while SLE itself can contribute to bone loss, one of the main culprits is long-term use of corticosteroids. It's a common treatment for SLE. These medications can weaken bones over time, increasing the risk of fractures.
So it's another example of that delicate balancing act we often see in medicine, right? Managing the disease while trying to minimize the side effects of treatment. What can people with SLE do to protect their bone health, especially if they're taking corticosteroids?
It's crucial to talk to their doctor about bone density testing and consider lifestyle modifications. Things like getting enough calcium and vitamin D, engaging in weight-bearing exercises, and avoiding smoking can all be helpful.
Solid advice. Now let's talk about another system that can be impacted by SLE, the digestive system. What kinds of gastrointestinal issues might someone with SLE experience?
So the digestive system can be affected in various ways, leading to symptoms like abdominal pain, nausea, vomiting, diarrhea, or constipation. In more severe cases, SLE can cause inflammation of the blood vessels supplying the intestines. This condition is known as mesenteric vasculitis.
That sounds pretty serious. What are some other potentially dangerous complications that can arise in the digestive system due to SLE?
Well, one concern is peritonitis, which is inflammation of the lining of the abdominal cavity. It's a potentially life-threatening condition that requires prompt medical attention. Another is pancreatitis, or inflammation of the pancreas, which can cause severe abdominal pain and digestive problems.
So any unusual abdominal symptoms should be taken seriously by someone with SLE. Now, before we wrap up this part of our deep dive, let's talk about one more area that can be affected by SLE, the muscles. Is muscle pain and weakness a common complaint?
It's certainly a frequent issue. Many people with SLE experience muscle aches and pains, known as myalgia. In some cases, they might also develop actual muscle inflammation, a condition called lupus myositis, which can cause weakness and elevated levels of muscle enzymes in the blood.
It sounds like SLE can really make even simple everyday movements a challenge. What can be done to manage muscle pain and weakness in SLE?
Treatment often involves a combination of approaches, including medications to reduce inflammation, gentle exercise and physical therapy to improve strength and flexibility, and rest to allow the muscles to recover.
We've covered a lot of ground, but now it's time to shift our focus to a fascinating yet challenging condition that often accompanies SLE. It's called Antiphospholipid Syndrome, or APS for short.
Yeah, from what I understand, APS involves those tricky antiphospholipid antibodies that we talked about earlier. Think of these antibodies as tiny troublemakers that target phospholipids. And phospholipids are these essential components of cell membranes, particularly in blood vessels. And this targeting, what it does is it increases the risk of blood clots forming in both arteries and veins. It's like these antibodies are throwing tiny wrenches into the intricate machinery of your circulatory system.
So instead of flowing smoothly, blood can get backed up, and that can lead to some, potentially serious problems. Where are these clots most likely to form, and what kind of complications can they cause?
These clots can lodge in various places, causing a cascade of potential problems. In the brain, they can trigger strokes. In the legs, they can lead to deep vein thrombosis, or DVT. This is a condition where clots form in the deep veins, usually in the legs. And in the lungs, they can cause a pulmonary embolism, which is a blockage of an artery in the lungs.
That's a sobering thought. Given its link to SLE, Are there any specific implications of APS for people already managing this complex autoimmune disease?
Unfortunately, yes. APS can significantly complicate the course of SLE. For instance, it can increase the risk of lupus nephritis, making kidney damage even more likely. It's like adding insult to injury for those already grappling with SLE's effects on their kidneys.
That's definitely a double whammy. Earlier, we discussed how SLE can accelerate atherosclerosis, increasing the risk of heart attacks and strokes. Does APS further compound that risk?
Sadly, it does. The presence of APS essentially throws gasoline on the fire, making blood clots even more likely to form in the arteries. This elevates the chances of cardiovascular events like heart attacks and strokes. It's a stark reminder of how crucial it is to manage both SLE and APS proactively.
So, early diagnosis and proactive management of both conditions are absolutely vital. What are some red flags that might signal APS, prompting further investigation?
APS can be a bit of a chameleon, with symptoms varying widely depending on where those clots decide to settle. However, some common warning signs include unexplained leg swelling or pain, shortness of breath, chest pain, and neurological symptoms like vision changes or difficulty speaking.
I understand APS can also have a significant impact during pregnancy. Can you elaborate on that?
Sure. APS can pose significant challenges during pregnancy due to its tendency to cause blood clots in the placenta. This can lead to complications like preeclampsia, a condition characterized by high blood pressure and protein in the urine. It can also restrict fetal growth and, unfortunately, even increase the risk of miscarriage.
That's heartbreaking. It sounds like close monitoring and management are paramount for women with APS who are pregnant or planning to become pregnant.
Absolutely. It's crucial for these women to work closely with their healthcare team to minimize risks and optimize outcomes for both themselves and their babies. This often involves medications like blood thinners to prevent clot formation.
What does it actually mean to live with SLE and APS day in and day out?
It's like living with a constant undercurrent of uncertainty, The unpredictable nature of SLE and APS with their flares and remissions makes it challenging to plan ahead, and simple activities can become monumental tasks on days when symptoms rage.
It sounds exhausting. Not just physically, but mentally and emotionally as well. It must be tough to constantly adapt to, the shifting sands of these conditions.
You hit the nail on the head. It's like walking a tightrope, balancing medications, coping with fatigue and pain, and adjusting plans based on the whims of your immune system. And it can be especially isolating because, on the outside, someone with SLE or APS may appear perfectly healthy.
Yeah. It's like having an invisible illness that's constantly throwing curveballs your way.
Yeah.
It's no wonder support networks are so crucial for people living with these conditions.
Absolutely. Having a community of people who understand what you're going through, who can offer empathy and share coping strategies can be immensely helpful. Online forums, support groups, and even just connecting with friends and family who are willing to listen can provide a sense of belonging and validation. And while the journey can be challenging, remember that you're not alone. There's a whole community of researchers, healthcare providers, and fellow patients dedicated to supporting you every step of the way.
Well said. And as we wrap up this deep dive, I want to leave our listeners with a sense of hope and empowerment. Research is constantly advancing, treatments are becoming more targeted, and the future holds immense promise for those living with SLE and APS. Until next time, keep those minds curious and those hearts open.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.